Good morning, everyone. Thanks for joining us. My name is Superintendent Asif Rashid. I'm with the Calgary Police Service, the Bureau of Service and Community Support. Joining me today is Robyn Romano, who is the Chief Executive Officer of the Distress Centre Calgary, and Glenda, Sahlen, Acting Commander of Calgary 911. Roughly 4 months ago, we told you about an exciting new call-diversion partnership between the Calgary Police Service, Calgary 911, and Distress Centre Calgary, or 211. At this time, we are committed to giving you regular updates. Today, we are pleased to let you know that hundreds of non-urgent calls to Calgary 911 have been diverted away from requiring a police response as part of this special partnership. Since early February, call takers at Calgary 911 have been looking for opportunities to connect some 911 and non-emergency line callers to Distress Centre Calgary. These calls include non-life-threatening and non-criminal calls that otherwise may have been dispatched to the Calgary Police Service. This includes connecting some calls from 911 to Distress Centre Calgary when the caller expresses the need to speak to someone about issues where there is no need for police, but they may not have otherwise known about that resource or who to call for support. Since its inception in early February, 248 non-urgent calls for help to Calgary 911 were assessed and transferred to the Distress Centre Calgary to ensure that the appropriate resources and response was provided. This included calls for service regarding housing disputes, for example, mental health supports or addiction inquiries, or otherwise child custody disputes and some domestic incidents as well. As community partners and as part of our overall commitment to our city, the CPS, Calgary 911, and Distress Centre Calgary have worked collaboratively to find a long-term solution for people who are better served with the right resource at the right time. This not only includes the call diversion program, but also a co-location initiative which sees 211 and 911 working together in a shared space. Our service continues to engage with the community and other social partners around alternative service delivery models and best practices. The CPS is also currently evaluating all calls that come into Calgary 911 and how they are dispatched. The call assessment project team aims to create a more efficient calls for service system that better identifies issues that can be handled by other City of Calgary business units or different processes. It's hoped by properly diverting calls for service, many of those non-appropriate response calls will be given to other appropriate areas, and police officers will have more time to address and investigate concerns that are identified as important by Calgarians. Other commitments to call diversion initiatives continue to progress with help from the non-for-profit sector in Calgary as we support other municipal and provincial partners as well. This includes the increase in hours of operation from the Mobile Response Team, the MRT, and the expansion of the Downtown Outreach Addictions Partnership, the DOPE program, as well as our police and crisis team in partnership with Alberta Health Services. Robyn, Glenda, and I will now be happy to take any questions, before which Robyn and Glenda will provide an overview of their work as well.
Good morning, everyone. I'm Glenda, the Acting Commander from Calgary 911. The implementation of this important project began in February 2022 and has been a coordinated effort with our partners at the Calgary Police Service and the Distress Centre Calgary and the City of Calgary 911. Our team has co-located the community-based crisis and system navigation services provided by 211 staff directly into the City of Calgary's 911 Operations Centre. The overarching objective of this pilot has always been to implement new ways to improve the response to non-emergency, mental health, and other 211 related services, resulting in better outcomes for Calgarians. Through an integrated cross-agency change management effort, our goal has been to provide an enhanced response to citizens through call diversion from law enforcement and into community-based services, ensuring that the Calgarians are getting the right support from the right agency at the right time. I would like to take this opportunity to reiterate that 911 is for emergencies and 211 is for social issues related guidance that may include resources for mental health, addictions, housing, and other social support requirements. Call 911 if you're seeing a crime in progress, if you see or smell smoke, if you see a life-threatening situation or witness an injury accident. Calgary 911 receives 3,500 calls a day, and we're everyone's 911. Thank you.
Good morning, everyone. My name is Robyn Romano, and I have the honor of being the Chief Executive Officer at Distress Centre Calgary. I'm so pleased to get to be here this morning alongside our amazing partners at Calgary Police Service and Calgary 911 as we talk about this work that we've embarked on together to really strengthen and transform how we serve Calgarians in crisis. Many Calgarians continue to call 911 when they don't know where to turn. They require services and supports and programs in their community to meet a need for themselves or to support a loved one. For the last 4 months, we've had an opportunity to do something a little bit different. Calgarians calling 911 with non-emergency needs now have that opportunity to get connected into their community. And we've done that by putting and co-locating 911 operators alongside our 211 staff. Through this process, they get to sit together, learn together, train together, collaborate, and really strengthen how we serve the community. So 211 is operated by Distress Centre Calgary, and we work to provide guidance and information for non-emergency issues, providing connections to the thousands of services, programs, and supports that are available within our community, but people often don't know about or know how to access. These can be things such as mental health, addictions, shelter and housing, basic needs, child care, family supports, among many, many others. All calls are answered live by a professional staff who's trained in conducting a thorough needs assessment, connecting with the most appropriate resource, providing advocacy when needed, and making a call back to check in to make sure that people really did get connected to that support and that their needs truly have been met. This service is available 24 hours a day by just dialing or texting 211. We are so excited to continue growing this partnership together and working across systems within our community to ease the burden of those who need help and support when they need it the most. Thank you so much for your time this morning, and we'll open it up to any questions.
Thank you for all being here. I think obviously the program is great. I mean, talk about that kind of handshake between the two. I mean, I think sometimes in the case of an emergency, as much as maybe we know on a calmer time, hey, 211 for these and 911 for these, when something's just affecting you, your brain just goes to 911. So having that relationship and now getting those people though kind of back on track to where they need that support, and like you said, maybe reiterate some of the numbers, how important that relationship's been even in this pilot project.
Well, I'll take that one, I guess. I think that's been one of the really key pieces of why we came together for this, is it shouldn't be up to a Calgarian to know necessarily where to go to access support, especially when you are in that crisis state. I think it is really the responsibility and the commitment of us across systems to come together and wrap around and be able to provide that support. And so we've been able to do that in the first 3 months of the pilot for 248 Calgarians. And those are people who are now further connected into their community. And we often know that that initial call to 911 is really just the tip of the iceberg. There's so much that's going on for somebody underneath that. And so through this partnership, we're actually able to start addressing, making those connections and focus on those deeper needs and hopefully mitigate any crises from happening down the road or get that further support for their situation. Oh, the catalyst for this change, and then I'll see if anyone else has anything to add. Yeah, I think it really stemmed from, I think we saw the state of mental health, especially in our community, and especially with the pandemic, more and more people have been impacted. I know for us at Distress Centre, people who have used our services for years, we're seeing them access our services in more complexity than they've ever had to before. We're also seeing people that have never had to access help and support before have to access it for the first time and have no idea what to do or where to go. And so I think in having conversations, we've worked really closely with the three of our organizations for years. We just saw opportunities that we could come together and we could just do things differently and we could do things better by partnering together, and again taking that burden off of the community and really having us be a system that wraps around the community for support. A lot of this work really has come from the city's mental health and addiction strategy, great strategy that so many community agencies and partners and systems are coming together to just create real change within our city and have this be the best place that it can be for everyone.
Glenda, can I ask you a question?
Yes.
Listen, I think of 911 and the 211 operators almost as a different species. The one group directing people through social services and the other people really ready for these more traumatic cases. How were you able to get them together, and what was that like, and the training involved, and how do you get people from meld? It's a bit like me melding with some of these guys, maybe. Not easy. Not easy.
So great question. We took a real phased approach, and we were always very aware of the cultural differences. As you pointed out, 211 has had a different mandate historically than 911 has had. So what we've really worked on was what differing possibilities might be and situations might be. So a caller may phone 911 and it is still a police patrol response. However, there's still the opportunity, with the help of our partners at 211, for my call takers to provide some de-escalation or some information sharing before patrol gets there.
What have you learned watching that? Because as it sounds to me, they're almost sitting side by side.
They are sitting side by side.
What have you learned? Like when you get those two together and they're really functioning well. What have you learned?
We've very much seen the collaboration between the two agencies and just what supports are out there for Calgarians. That doesn't have to be necessarily a law enforcement response. We can offer, with 211, all kinds of opportunities, and like Robyn said, provide that wraparound care, so then that person has that information and will know where to go next time.
Could you talk about the logistics a little bit? I mean,
Mhm.
COVID is obviously, I'm not trying to be little, so understand what I'm saying. It's like, it's more, you have to deal with that call, because I mean, there's like hundreds of more calls coming in.
Mm-hmm.
When you had them kind of separated before, it's one of, okay, well, I got a call over there, but there's something about, hey, they're actually in the same building, they're literally right down the hall, is to be able to have that passive information maybe even sooner, that now you're kind of collaborated, and then there's that kind of maybe deal with the call even faster than maybe even historically those calls would be done.
I think one of the biggest differences, to your point, is in the past, Calgary 911 may have recognized that we know that 211 Distress Center can offer more resources than we can. So we would tell the caller, you can call 211. Or we would transfer the caller to 211, but we had no ability to know if that actually happened and then what the aftercare was like for the caller. The 211 folks are literally side by side on the 211 operations floor. So they the 911 operations floor. So they have the ability to say, wow, I've got this, can you help me with that?
And maybe for the CPS side, is this a relationship that hopefully you'd like to see maybe get into the vehicles? Because I know, like you mentioned too, I mean, there has been a lot of more of, I hate to say it, but in the city with COVID and everything that's been going on, mental issues in the city. And I've heard the calls. I mean, any of us with a scanner, you hear it over and over and over again. Is part of that relationship too is to help kind of maybe boots on the ground too, because now there's that connection right away on that call with 911 and 211 that can get the officers to say, hey, perhaps there's a better way to deal with this.
That's a great question. So this initiative, this project, is part of a larger transformational change towards a more social model of policing. As we heard from our partners, we know that there is a number of various resources that exist for our community partners. However, our community has expressed that systems navigation is complicated, it's nebulous, it's ambiguous. Our officers feel much the same way. And so through our partnerships with the Distress Center and 211, each of our officers actually has access to 211 resources right on their smartphone. They have real-time access into the Calgary 911 Center so that they can better serve our community in connecting them, doing that warm handoff with those resources.
And that's just that one of those steps that like as everything else is evolving, this is also evolving. So it's kind of that next level of care for the individual who may have called in the first place.
Absolutely. And this is an iterative process, I think, has been explained throughout this conversation, is that there are no absolutes. It's not as though we're going to have a community partner respond, but not without police, or maybe police go and there's no community partnership there. We kind of see it as a continuum of care to enhance the level of services that all Calgarians are getting.
Over the 4 months, it was 240 calls. Are you looking forward to increasing that? I know, are the officers, there's two things I'm thinking about. The reward of being able to contact social as an officer, the reward of, you know what, I can actually help this person more than I was able to the week before. And are they seeing a decreasing workload, or do they feel any, reward in the sense that there's, maybe the workload is slightly decreased, or that they're not dealing with those kind of calls?
Yeah, no, absolutely. There is some fulfillment that comes with having a resource available to us as patrol officers at 3 o'clock in the morning when we need to call a friend, and we have a friend available to us in the 911 center that can actually help us navigate a person in crisis through a very traumatic situation. I mean, historically, by having police as the exclusive service provider to people in crisis, we've essentially, as a community, criminalized underlying social and psychological issues such as poverty or trauma or homelessness. And we understand that that's probably not the best mechanism for which to serve our most vulnerable.
And again, the other side of the note is that kind of ultimately the idea is like, if now with that relationship and maybe some of these phone calls can be dealt with now with the distress center, or we know that caller is going to the right area, is, I mean, you see that CAD, the calls are just coming in, is help alleviate maybe the workload on the streets.
Yep, Call-Diversion is absolutely one of our more aspirational outcomes of this pilot project.
If I throw a quick, do you guys want to share some of the examples?
Yeah, I'm happy to do that.
Yeah,
Got some
okay.
really good stories of calls that have come in.
So I just have a couple examples. Sorry. So this was what we call a warm transfer in this new model. So that is where Calgary 911 receives the 911 call, and we're warm transferring it to our 211 partner beside us. So this was in the same room. It was a senior citizen living in Calgary, and she had to move because her building was being closed. She called 911 because she needed assistance with cleaning her building or her apartment. So 211 was able to arrange an intake conversation with a group called the Way In, and the senior citizen received assistance in not only moving but cleaning her apartment. So when we talk about numbers, the 248, I think the important focus right now is the 248 people that are arguably vulnerable that we have provided assistance to.
Can I interject before you go on the next?
Yeah.
It just hit me too. What does that mean for your crew, the 911 dispatchers? Like you said before, it's kind of like, okay, we're going to move you here, but we never know what happens over there. Is there a little bit more of that? Hey, I now kind of know what happened, and there's that kind of sense of what am I looking for? Like a little bit more of
Camaraderie and teamwork.
you know what I mean? And maybe they even feel a little bit better in their workplace because it's like, hey, now I understand that kind of process and I see it now.
Is there a growing of both organizations through this? And actually, all three, are you growing? Do you feel growth through this, like intellectual growth?
Absolutely. I know my people are learning more, to your point, that they're able to have an understanding of what happens after the transfer, the warm transfer to 211, and it's just arming us with more information about what resources and services are available.
Okay, and so I didn't mean to interrupt.
No, all good.
And I think, Robyn, do you have one you want to share?
Sure, I'll go one more. So this caller shared that the children in the home were struggling with past abuse, and the caller was looking for some mental health supports for the children and legal aid advice. So with the collaboration of 211, we performed a risk assessment for immediate domestic violence concerns, suicide, and a safety plan was conducted. The caller was provided with a mental health intake assessment form for referral and resources for legal aid, domestic conflict counseling. What was interesting and very different about this one was, with the permission of the caller, we were able to offer a follow-up phone call the next week to ensure that the resources needed were the resources that they had. And I would say that in the past we have not done that.
You know what, this is hugely rewarding for you.
It is.
Your eyes of acuity, and because of this program, isn't it? Tell me why. Because here's my thought. You've been thinking about this for 2 decades. So like it's been in your mind, or people's minds, your mind.
Thank you for that. I've worked for the City of Calgary and for 911 for 35 years, and this is the most pivotal project in my life career. I've worked on technology projects and this is the one, when I retire, that'll be the most meaningful for me.